Lebanon has had more than 400,000 COVID cases, with over 5,000 lives lost. The country began rolling out its vaccination program last month, and more than 86,000 doses have been given out. But there are an awful lot of hurdles. Lebanon's economy was in tatters before this pandemic began, which has made the battle even harder. A short time ago, I talked with Dr. Nisrine Bazarbachi, who runs the largest hospital in northern Lebanon. It's in Tripoli, which is Lebanon's poorest city. And I began by asking her how the pandemic has hit her hospital.
The country has collapsed. The COVID pandemic has added to those a very big problem that we believe will only get worse. If the situation in the whole country is so bad in the north, and especially in Tripoli, it's much worse. It's due to many factors. As you know, Tripoli is considered as the poorest city on the Mediterranean. We have a high percentage of unemployment. It's around 60 to 70% actually. An unemployed person, it's a whole family without medical coverage, without income, without education. So the COVID pandemic we're facing actually started exactly 1 year ago. We've suffered for many problems. We had many lockdowns, some partial, other complete, but it was not respected in Tripoli. It's due to the poor economic situation. People has to work on a daily basis to get their money. They have choices to die from either hunger or COVID.
How has this political uncertainty and the financial ruin that is facing Lebanon specifically impacted the health system and your hospital? Tell me what's going on in your hospital on a day-to-day basis. How are you coping?
We have many problems. As I told you, the main problem is the lack of medical teams. Every day, we have a large number of our doctors leaving the countries. We don't have enough nurses to keep on a daily basis with the activity we're facing with a large number of COVID patients. We've adapted our activity, mainly 2/3 of our activity actually is a COVID activity. We're suffering a lack of, as I told you, medical equipment, gas oil. We have a daily problem to cope with all these lack of equipment, medicines, gas oil, maybe personal equipment. It's really a hard problem to deal with.
Dr. Nisrine, the World Bank has spent $34 million to fund Lebanon's COVID-19 vaccine drive on the condition that doses would go to the most vulnerable groups first. Now, lawmakers in Lebanon breached that deal by jumping the vaccine queue. In response, the World Bank's regional director has threatened to withdraw the funding, tweeting, I quote him here, upon confirmation of violation at World Bank may suspend financing for vaccines and support for the COVID response across Lebanon. I appeal to all, he said, I mean all, regardless of your position, to please register and wait for your turn. This suggests that corruption and nepotism continues through the vaccine rollout. Just how is that impacting on Lebanon, on those who clearly need and should get these vaccines at present?
My dear, violation, it's a normal, it's actually a fact that we're accustomed to in our daily activity in Lebanon. It's not the only violation we have. For the vaccination, there's many problems we're facing actually. Do you imagine that we don't have enough vaccine for the medical staff? We started our vaccination 3 weeks ago, and until now, our medical staff is not completely vaccinated. our frontliner are not completely vaccinated. So we have a lot of problems. We've started, but without the implication of the private sectors, I don't think we can manage this big problem.
How long do you think it will take for the majority of eligible Lebanese adults to get vaccinated?
If it will continue like it's happening like now, I think maybe we will need 2 or 3 years to vaccinate all the Lebanese eligible people. It's a big problem we're facing actually, and we're raising the voice every day to say without the intervention of the private sector, will not be able to manage this pandemic of the COVID-19. We need the intervention of the private sector so we can vaccinate the majority of the Lebanese people, and very quickly.
And refugees and migrant workers, of course, account for roughly 1.5 million of these 6 million people in Lebanon. Migrant workers, at least, seem to be ineligible for the vaccine based on guidelines from the Ministry of Labour. Just how dangerous would it be to exclude them from this vaccine rollout?
They are living in the country, so they have to be vaccinated like the other population of the country. Otherwise, the pandemic will continue to grow and will not be resolving any problem. They have to be registered on the list of the people to be vaccinated, of course.
Dr. Nisrine Bazarbachi, who runs Heikel Hospital in northern Lebanon there.